I think there's a sense that, oh, my anxiety doesn't really matter because everybody's all going through this at the same time. And so who am I to ask for help? But what you are feeling and what you're experiencing matters.
We're living in the pages of future history books. We're experiencing things we never thought could happen, even though by now, every day feels like Groundhog Day. And the news feels like one long breaking news story.
As the coronavirus pandemic spread, stay-at-home orders.
Everybody has a role to play here.
The U.S. now leading the world in deaths.
But everything, all of it, is unprecedented.
Unprecedented.
This time has taken a toll on our mental health. For some, the coronavirus may bring new levels of anxiety, depression, and loneliness. For others who have experienced mental illness for years, symptoms may only get worse. There are more people vulnerable to the effects of the coronavirus than we think. Who are they, and how can we help? You'll probably find in conversations with your friends and family that you and most everyone you know is more anxious, sad, or hopeless. Some experts say we're collectively experiencing the stages of grief. This is Dr. Vale Wright. She works with the American Psychological Association.
I do think one of the things that makes this situation different than, say, 9/11 or past hurricanes is that in some ways the threat is invisible. Everybody needs to give themselves a little bit of a break right now.
Deseret News in-depth reporter Erica Evans wrote a story about how shelter-in-place orders and statewide shutdowns are affecting those with mental and substance abuse disorders.
I talked to one individual who has suffered from a variety of mental health problems, from PTSD to eating disorders to anxiety and depression and suicidality. And she was in a really good place before all this happened. You know, like it did for a lot of us, the coronavirus just sent everything into a tailspin. She had to return and cope with some of the symptoms that she had already overcome.
Dr. Doreen Marshall has worked for years as a psychologist and now works with the American Foundation for Suicide Prevention.
I think what's challenging for folks that have more severe mental health issues is that routine, which can be really important in terms of anchoring our day-to-day, has been disrupted.
For example, a disruption in grocery shopping and eating habits can be hard for those struggling with eating disorders. Stress and isolation can be triggering for those recovering from addiction. This time can also be hard for seniors.
One of the things we know right now is that our seniors are very isolated. They're also a group that tends to be at higher risk for suicide specifically.
There's potential for suicide rates across the board to increase during or after the pandemic. Here's Dr. Elspeth Ritchie, Chief Clinical Officer of the Department of Mental Health in Washington, D.C.
But I am seeing people come into the emergency room who are just desperate, either the homeless that we talked about earlier, or people who just can't tolerate the anxiety. And so I'm expecting to see an increase in the suicide rate.
But Dr. Marshall emphasizes that increased suicide rates don't have to be a sure thing.
What we want people to understand is that you can do things to take care of your mental health, that suicide isn't a foregone conclusion at all. In fact, we don't know what will happen, but we certainly don't want those who are vulnerable to be out there assuming that this is something that they have no control over.
At this point, things might seem pretty discouraging. But the good news is that there are lots of ways to help yourself and others. Start with the basics.
Are you feeling muscle tension? Are you clenching your teeth? Are you having headaches? Are you having trouble sleeping? That's one of those red flags that your body's trying to send you that you're feeling overwhelmed and you need to make some adjustments.
The biggest thing that you can do is to not be afraid to reach out and get help.
Healthcare providers have all made a really strong effort to move to telehealth and to provide the same services virtually as they do in person.
The crisis lines are in full operation right now. A lot of people, with everything shutting down, think, okay, those supports must not be. They are operating, they're answering lots of calls.
Finally, don't give up hope.
If you are struggling, reach out for help, whether that's to a friend or to a family member or to somebody who provides mental health care. I think there's a sense that, oh, my anxiety doesn't really matter because everybody's all going through this at the same time, and so who am I to ask for help? But what you are feeling and what you're experiencing matters, and you should get the help you need.
Thanks for watching our video, and if you do need help, here are some great resources. And here's Ted. Oh, Daddy. Okay, tell me when.